They swallow and cause inflammation around the fingers. Okay, and basically the pulley that hold the tendon, okay, that pulley basically getting very thicker, and due to the thickness, and they Assalamu alaikum and welcome to our YouTube channel. My name is Dr.Syed, and in this video we will discuss about a condition called trigger finger. Alright, so if you are new to this channel, please like and subscribe our channel and share this video to your family and friends. Thank you. Let's start our topic. So trigger finger is basically a condition that make our fingers or thumbs too hard to move. All right, so trigger finger is a condition that affects on our thumb and fingers. So we have to understand the mechanism, how the the tendon is affecting by trigger fingers. Okay, so in our forearm, basically in our forearms contain the flexor muscles. Okay, and the function of the flexor muscle is to allow and help our fingers and thumb to move. Okay, so our fingers and thumbs are moving due to the flexor muscles from our forearm. Okay, and the tendons are long cord-like structure that connect or attach the tendon to the bones of the like bones of the forearms. So function of the tendon to attach and connect the bones. Okay, so what happened in the due to some inflammation or due to overuse of the muscles, okay, our tendons become inflamed. Okay, the tendon become inflamed, and that causes difficulty in bending our fingers or thumb. Okay, so this is basically a mechanism of the trigger fingers. Okay, and the tendons also held by a tissue called tendon sheath. Okay, the tendon sheath is a tissue that basically hold the tendon as well together. All right, that tendon sheath is just around the tendons of the muscles. Okay, so function of the tendon sheath is basically held the tendon, and they due to this tendon sheath our fingers and thumbs are move. Okay, but what happened, there is another band, it's called the pulleys. Okay, the pulleys are also help our fingers and tendons in our forearm, and they help the tendon to move and help in the moments of gripping movement and holding objects, or they are very helpful. Pulleys are helpful. They are the basically a tissue, and they are helping the tendons around our muscles of the arms and forearms. All right, okay, especially in the forearms and the fingers. Okay, so what happened over the time when you frequently use your hands, or you're doing some kind of job that involve lifting heavy objects and lifting weight, or due to your activity, and over the use of over the age of like around 40 and 50, this condition develop. All right, so our tendon become very swollen. They swallow and cause inflammation around the fingers. Okay, and basically the pulley that hold the tendon, okay, that pulley basically getting very thicker, and due to the thickness, and there are some nodules develop due to the inflammation and swelling. There are some nodules develop around the pulley, and that causes our hands, especially the finger, to difficulty to move due to inflammation around the pulley. Okay, so that pulley is basically hold the finger in that position, in, for example, in the bent position, and sometimes it is very difficult to move your finger, all right, or your thumb in that position, in the lock position. So sometimes you need to do forcibly move your finger with the other hand, or you have to perform some exercises that are very helpful, and they resolve the symptom. Majority of cases the finger and thumbs are involved, and they are in lock positions, all right. So basically it is very hard or sometimes impossible to straighten our finger, okay. So it is difficult if the finger in bent position, and it is very difficult to straighten our finger or thumb, all right. uh, so what, let's just talk about the symptoms. The most common symptoms are uh, feeling of pain and stiffness in around flexor tendons, okay, and around our palm, and also snapping or popping feeling when you move, okay, snapping feeling, or you can feel something is sticking or something is very catching. This is called your triggering finger, okay. Some things you feel your digits are difficult to move when they are catching or getting stuck. So this is due to the pulley, the thickness of the pulley. Some nodules are developed. That pulley's thickness or inflammation or swelling cause difficult to move our fingers, or they are sometime in the bending position, okay. And the most common, due to there are some risk factor involved. Sometimes people who have a condition called osteoarthritis, rheumatoid arthritis, diabetes, and gout, and amyloidosis, or some patient who have some issues related with their thyroids, okay. So basically, the first of all, it is very important to diagnose the condition. So doctors usually examine your fingers, and they ask you to perform some movement of your fingers or thumb, or they ask you to do some test, physical examine, and they diagnose basically, oh, this is a trigger finger, and they offer you some treatment, okay. So most common treatment is the rest, okay. Take a break from your work, or especially those type of tasks that involve your fingers and thumb, and they offer you to wearing a splints, or some stretching exercises are very helpful to resolving your fingers. Or sometimes they offer you a anti-inflammatory medications such as NSAID, brufen, and paracetamol, and also steroid injections are very helpful, okay. If those conditions, your symptoms are not resolving after conservative management, or after doing all the things, then the option would be to perform a surgery. In surgery they usually release the tendon, okay, the tendon that causes the triggering. They release the tendon, and after releasing the tendon, they incise the tendon, and they basically cut and incise the tendon, and they perform they release your trigger finger after basically the pulley. Then they check your tendon is moving, then they basically cut the pulley that causes the symptoms, and that causes the lock, then the locking of your fingers or thumb, okay. So surgery is the option, and they basically release that tendon that causes the issue, all right. So and also basically this happen to anyone, okay. And in severe cases, that is your 10 fingers are continuously in the lock position, and this is also called tenosynovitis, or inflammation of the finger, okay. So thank you so much for watching this video. If you have any question, please you can ask freely in the comment box. Thank you so much. Bye.